Okay, so I'm going to start with just a little meditation. And get my foot under there. Just to get centered, and the abdominal diaphragmatic breathing, which we did 2 weeks ago. And I'm just going to get settled in. The great part about this is that my feet are elevated. My foot, my ankle's elevated. Just kind of wiggle my toes a bit. So I've normally been doing this abdominal diaphragmatic breath about 3 to 5 minutes, sometimes longer. And again, it's great. And normally I'm not talking, but I'm just explaining it to you. But it's great to not only calm the nervous system, it's great for pain control, pain management, but also I'm elevating my feet, so it's just great. It feels so good just to elevate and get centered and completely surrender and completely release. So this is pose 1. Okay, so after a few minutes of that, we'll come down onto your side first, of course. Chair is nearby because we will need that later for support. And we're going to start with just some basic activation exercises of this left leg. So we're going to tighten the quad. It's a quad set. Tighten the glute just to get some of those muscles pumping, which is nice to keep that leg active and keep the blood flowing. Then we're going to lift the leg. So it's a basic straight leg raise that you might see just sort of with any kind of knee, hip, or rehab program, but nobody really ever tells you, to work this whole leg, like if you have an ankle injury. So there's lots of things that we can do at the hip level, the core. So I'm working lumbopelvic stability. We'll go through this in a later blog post, but I'm activating my core, keeping it stable. And normally I do about 20 or so of these. And then I turn on to the side, activating the core once again. Adduction now lifting. So I'm just going to work all the muscles around my hip, keeping the leg as strong as I can. Because remember, it's going to be non-weight bearing for 2 months, so there's going to be a lot of muscle atrophy, which not only in and of itself is, for the all apparent reasons, that's not good to have a weak leg, but there's going to be the asymmetry as well. And that can cause a lot of back pain and pelvis and all kinds of different injuries when you have the asymmetry. And then I go onto my tummy, and I'm going to try a leg raise here. This one's tough for me. The cast is heavy, and I guess my posterior muscles, hamstrings, glutes, they're on that left side, they're really getting weak this past week because I can hardly lift my leg here. But as I exhale, core engages, lifting, trying to keep my neck relaxed, my face, my jaw, trying not to brace with my upper body. So I normally do same thing, try about 10 or 20 of those. And then I go into abduction. I'll just switch here so you can see me. So again, core engages. Just a basic hip abduction motion. And sometimes I'll vary it up and I may do a bit of a clamshell, which again is great for lumbopelvic stability, or I might even get my hip external, internal rotation, just really warming up that hip joint. It feels so good because I'm just not moving this leg at all. So okay, so next up, This one is one of my favorites, and I'll tell you why. Right here, and this is it. Just knee to chest. But this left leg that's in the cast, it's always, the hip's always flexed, because when I'm using my crutches, you have to kind of hold the leg up. So my hip's always flexed, or if I'm elevating, so if I'm sitting and eating, it's always up on a chair, so that it's always flexed. And this is one thing that I would highly recommend to anybody who has an affected ankle or anything on this leg, is to try to do the opposite motion, as long as it's not contraindicated for your injury. But this looks simple. It looks like I'm not doing anything, but I can sure tell you that my left hip flexor, that front hip, is really stretching. And I'll just kind of warm up my right hip, just circling both ways. And again, a lot of this, I would spend way more time, but just for the purpose of this video, I'm kind of rushing through everything. And then just a straightening, and this leg is getting very, very tight because it's doing all the work all day. So this is super tight hamstring and calf here. And I'm not going to do a prolonged passive stretch at the beginning. It's not quite warm enough for that. Muscles like to be moving, sort of a more dynamic warm up. Opening up into sort of a half happy baby, and then taking it across the body. And again, this just feels great all the way around, and it gives me a sense of being, I don't know, I guess a sense of normalcy, so that I can still do stuff, I can still practice. And then the other leg. So this feels good on the right now, just to stretch the front of that hip flexor. And I can warm up this hip too, both circles. And then gently straightening it up. And I can't move my ankle at all, but I can certainly move my toes. And then I can come into a half happy baby. And this, even just something simple like this with my right arm out to the side. Those of you that have used crutches before, you know that it's really tough on the upper body, can be hard on the neck and wrists. So there's lots more that I do for the upper body and the wrist. I'll get to some of it today. It even feels good on my low back. And then I've even been just sort of dangling like this, and there's a phenomenon in your body that's kind of neat. It's like a crossover effect. So I take this leg that's working nicely and I scrunch the toes and point the toe and just visualize that my other foot's doing that. And then I dorsiflex that ankle, pull the toes, splay them. Same with the other one. Of course, the other one's not moving, but I really just sort of meditate and breathe. And just almost like you're imagining and doing some mental imagery of the other foot doing the same.